Well, Dr. Belinda Uba is a public health epidemiologist, field epidemiologist, African Field Epidemiology Network, and she joins us on the program from Abuja. Thank you for joining us. Tell us, we're seeing some states in Nigeria, just like several countries, adopting stricter non-pharmaceutical interventions like fines for not wearing the mask or even arrests, and then in some places compulsory wearing of the masks indoors to keep the virus at bay. What do you make of these measures?
Thank you for having me. I think the measures are quite right. They are measures in the right direction. We know that COVID-19 is a new disease. We are all learning from it. And we know that part of it is making sure that we put in all the necessary preventive measures. The wearing of face masks, the physical and social distancing, the hand washing. I think those are very right measures that the government is putting in place. And we really want to advocate to our people out there to actually make sure that they are adhering to this. A lot is happening out there. A lot of people are still not putting on their face masks, and we begin to wonder. We don't have any vaccine yet, so the only way we can prevent ourselves from COVID is really making sure that we put in all the non-pharmaceutical preventive measures. And part of it is using our face masks, whether indoors, in populated areas, and when we are outside there. So I think there are measures in the right direction, and we really will want to encourage everyone to really adhere strictly to these measures, make sure that in public places people are observing all the necessary physical distancing, there's hand washing equipment, people are putting on their face masks at any point in time just to make sure that we do not really have to come into contact with this COVID and either contract it or take it to our families as the case may be. So I want to say that these are measures that are in the right direction, and I think the government is doing a lot to ensure that people are really adhering to these measures.
So would you say that there is enough information and enlightenment, ongoing to make sure that people actually know what kind of virus that they're up against, and which would, of course, influence their behavior towards protecting themselves and their loved ones?
Yeah, I will say the government has really done a lot in terms of trying to educate the people. Right from when we had the very first case of COVID-19 in Lagos, we've been having a lot of jingles. Anywhere you go out there, the radios, the TV stations, we have jingles running on a daily basis. Before every program, there are jingles on the preventive measures, use of face masks, hand washing, social and physical distancing. Government is really doing a lot in this regard. I think we really have to take it upon ourselves as individuals to make sure that we adhere to these measures. Part of it is for people to really know the risk involved, because a lot of people out there still think that COVID does not exist. I've come across so many people who will still say, oh, there's no COVID, this is just a propaganda by government. They want to see people die near them before they can really believe that COVID is out there. But we get all these jingles running in the TV stations, educating the people about COVID, educating them about the risk involved, educating them about how we can actually prevent ourselves from coming down with COVID. So I think a lot is out there. A lot of messages have gone out there. It is now left for people to actually accept these messages, have some trust in government, believe in what the government is telling them, and adhere to these measures. I'm sure if these are put in place, we'll be able to curb and interrupt the spread that is really going around across the different states in the country. We are seeing a rise in some states, even though we could be seeing a decline in some, but in most states, we are actually seeing a rise in the number of cases, looking at the fact that the government is right now opening up the economy, so there's more interactions, there's no restriction. So adhering to these measures is really something that people have to take it upon themselves to change their behavior and to be able to adhere to these measures and prevent the spread of COVID-19 in the country.
Dr. Bart, when you look at the measures that have been adopted, and this is looking at Africa and flattening the curve on the continent, would you say that perhaps our lack of testing is undermining the successes on the continent?
So looking at the country and the continent as a whole, I would want to say that as a country, we've really done a lot. Like I said earlier, it's a new disease we are learning, and we're actually learning from the mistakes of other countries. You know, Nigeria is one country that is quite diverse cultures, that you really can't just pick up Nigeria and start comparing with other countries in the continent. I mean, when we started having the first case of COVID, you know, I could remember we had just one lab that was testing, and we can see that over time we now have so many labs. We have over 46 testing sites for COVID-19. NCDC then, a lot of Nigerians didn't know about NCDC. Now everywhere, everybody is singing about NCDC. If you wake people from their sleep, they will tell you about NCDC. That shows that the government is really doing a lot. One good thing about the country is that even our political leadership has accepted that there is COVID actually, and they talk about it every day. We see it on the PTF. And we've seen this in other countries where the leadership is not even accepting that there is COVID, and we can see what has happened. So really, as a country, I want to say the country has really done a lot from the advice we get from NCDC, from the PTF, and then what is going on across various states. Yes, we might not have been testing enough at the onset, but right now I think we have really improved in the testing capacity with the many labs we have across the various states. A lot of testing sites are being put up in place, and even the numbers being tested are increasing day by day, including the turnaround time for the results. So prior to now, you could have a situation where results take quite a while before they are released. Now we have situations where tests are conducted and within 24 to 48 hours, the results are out there. So we are really improving, and I would say the government is really doing a lot. NCDC is doing a lot to really ensure that the testing is being done, the test kits are available across the state. We've not had situations where states are complaining that they don't have test kits. So I think testing is really being improved over time, and government is really doing a lot in that regard.
All right, we appreciate your time. Thank you so much for joining us on the program. Dr. Belinda Oba, a public health epidemiologist. Thank you.